Tonight I'm going to be refuting the main claim that reducing the legal drinking age would decrease harmful patterns of consumption. My advocates' three supporting claims were: 1, if 18-year-olds are considered adults, then they should be allowed to drink. 2, that lowering the drinking age would create a safer college setting. And number 3, the lower drinking age in European countries results in more responsibility. I choose not to challenge the advocate's main claim, but rather the evidence that my advocate has provided, with which I would like to claim that my advocate failed to provide sufficient and relevant evidence to support her main claim. First of all, the main claim is vague in that we are not informed of where reducing the drinking age would decrease harmful patterns of consumption. It is clear that there is a cause-effect relationship taking place. The legal drinking ages are different in many countries, and providing a specific country would further strengthen the effectiveness of the main claim. My advocate's first claim, which was, if 18-year-olds are considered adults, then they should be allowed to drink. This claim, which has been generalized, has insufficient and irrelevant evidence. Her first example of evidence was that in Virginia, you can get a hunting license at age 12. Actually, according to the California Government Department of Fish and Game, people as young as 10 years old may be able to get their hunting license, just as long as they pass a series of hunting safety courses. However, even when I make this clear, it's hard to show the relevance to why legal adults under 21 should be allowed to drink. My advocate's second example of evidence, or her first secondary claim, is that at age 18, you can enlist in the military, vote, get a tattoo, get married, and apply for credit. However, listing all of the things that 18-year-olds can legally do doesn't suffice as appropriate support for this claim. In fact, these examples weaken the claim. According to the Spokesman Review article by Jenny Ross, turning 18 brings new rights and legal options to teens, but it doesn't necessarily prove that these new adults have the judgment to use their rights responsibly. My advocate's second claim was that lowering the drinking age would create a safer college setting. Her first example of evidence was that a vast majority consume alcohol before 21. I would like to point out that there were no statistics to show that there was a vast majority. According to the Center for Disease Control and Prevention, people aged 12 to 20 years drink an average of 11% of all the alcohol consumed in the United States. As you can see, 11% is not a vast majority. And even though even though I've pointed out or made this example clear, it is still unclear as to how this would help create a safer college setting. My advocate's second example of evidence was that binge drinking begins at an early age. Using early age binge drinking as evidence actually weakens this secondary claim. According to the CDC fact sheets for alcohol and public health, there were approximately 190,000 emergency room visits by persons under age 21 for injuries and other conditions linked to binge drinking. This statistic does not contribute to the safety of a lower drinking age, but rather the harm of a lower drinking age. And my advocate's third claim was that the lower drinking age in European countries results in more responsibility. I'd like to point out that her main claim, her third supporting claim focuses on European culture, and this is kind of confusing because she does not state specifically what country she's talking about in her main claim. And her first example to support her third supporting claim is that parents drink with their children, and with that they learn how to drink more responsibly and develop responsible drinking habits. However, according to the Minnesota Department of Health Reducing Underage Drinking article, the younger a person starts drinking, the more problems. The research suggests that young people who begin drinking before age 15 are 4 times more likely to develop alcoholism as compared to those who begin drinking at age 21. My advocate's second example to support her third claim is that a lower drinking age would prevent the need for the forbidden fruit. The specific definition of the term forbidden fruit is not provided, as it has several different meanings. I assume that she is referring to sex. So there is no explanation as to how this relates to the lower drinking age in European countries and how it results in more responsibility. According to the CDC fact sheets for alcohol and public health, youth who drink more alcohol are more likely to experience unwanted, unplanned, and/or unprotected sexual activity, which contradicts the speaker's idea. In conclusion, I chose not to challenge the advocate's main claim, but rather the evidence my advocate has provided. Her main claim was that reducing legal drinking age would decrease harmful patterns of consumption, with her 3 supporting claims being: if 18-year-olds are considered adults, then they should be allowed to drink. Number 2, lowering drinking age would create a safer college setting. And number 3, the lower drinking age in European countries results in more responsibility. I believe that my advocate has failed to provide sufficient and relatable evidence to support her main claim. Thank you.
Okay, the main and secondary points are pretty clearly labeled. Your general approach is explained. Signpost on the first point was clear, but the relevance of the issue was not. I'm not exactly sure what advantage you get on providing California data on hunting rules versus West Virginia data on hunting rules. I think what you have a better argument on is the notion that there might be some variation in what people's abilities are at different levels. You actually had a piece of evidence that you cited. You kind of suggested that it was counterproductive, it had the opposite effect, but that's not really what the evidence said. It said that just because people get these responsibilities at 18 doesn't mean that they're prepared for those responsibilities. And I thought that that was actually a better claim than the argument that you were trying to make. On the second point, you challenge a lack of statistics there, and then you provide some numbers. I'm not sure that your numbers are all that more convincing. Sometimes they're a little bit confusing on that. This whole discussion of binge drinking is, I think, not being understood clearly here. You're kind of citing the negative consequences of binge drinking. I don't think that the advocate is suggesting that binge drinking is a good idea either. In essence, I think the inference that the advocate was making is that binge drinking is a consequence of the high drinking age, and you need to have some stronger explanation about why the two are not really connected to each other. Kind of ran into the same problem with the forbidden fruit issue. I don't think forbidden fruit is really referring to sex. It's referring to those things that were denied becoming more attractive because we're denied them, and of course alcohol being one of those things that's denied people under the age of 21, then they have a hyper need to consume at that particular level. I thought your Minnesota study, on the other hand, was a lot more specific about applying to that argument, and that you needed to have a more declarative statement on that. It was 7 minutes and 15 seconds, so you're going to have to be quicker. On the debates, we're going to cut people off because we